Hello, I'm Diane Trees. Orange County narcotic agents reported a 150% spike in heroin overdoses from 2016 to 2017, just in the first month and a half of this year. Orange County Sheriff Jerry Demings says people who buy illegal drugs are playing Russian roulette with their lives. He joins us now to talk about how he and his deputies are working to contain and proactively deal with this sweeping epidemic. Sheriff Demings, welcome.
Thank you for inviting me on the show.
Just how big a problem do we have?
We have a significant issue with the amount of narcotics being sold and distributed in our community. In fact, it's not unique to Orange County. This is something that we're seeing really throughout the east coast of the United States as well as within Florida. Here in Orange County, we have seen this significantly increase in terms of the number of overdoses by 150% the first couple of months of this year.
That's enormous. What do you think is causing this really dramatic increase in heroin usage?
As a society, I believe that we now chase euphoria. Some people attribute the uptick to the crackdown on the pill mills or the pain clinics that we were engaged in during 2009, 2010. But for me, it's not quite that simple because we are seeing young people who are in their teens, 17, 18, 19 years old. Well, back in 2009, 2010, they were not opioid abusers at that time. So we see a lot of young people and we see people who have been abusing drugs for a period of time, including those who were abusing drugs like Oxycontin and oxycodone back during 2009, 2010.
Yeah. So a whole span of people. What did you mean when you said that people who buy illegal drugs are really playing Russian roulette with their lives?
When you're not purchasing a narcotic that has a specific dose like what you would buy with prescription medication, it is very precise. Someone in a lab has measured that out. But what individuals are buying on the street is something that a drug dealer has concocted in most cases. And you can't, in many instances, look at a narcotic and tell specifically what it is. In fact, many of our heroin abusers, they believe that they're buying heroin when in many cases they're purchasing fentanyl. Looks the same, however, fentanyl can be 1,000 or more times as potent as drugs like painkillers that you may purchase, through a prescription.
Right. I would imagine a lot of these people are so desperate, they're not even concerned with that. They just need to get the next amount of drug and go from there, from a day-to-day experience.
Well, when you're high, you don't make good decisions, and you're almost willing to take anything at that point to maintain the high, the euphoria that you're feeling.
How are your deputies trained and prepared for the drug overdoses, especially with the amount of calls you're now getting?
We have some mandatory training that we work with the Drug Enforcement Administration to be able to recognize the current trends and the distribution of narcotics in our community. We also get quite a bit of feedback sometimes from our healthcare industry about what they're seeing in our emergency rooms and other places where individuals are overdosing. And then some of it is just plain old experience. After you've been out there for a while, you know what to look for and what to take action against.
Right. You mentioned that you see a whole gamut of people and users. Are you seeing anything that's like a common denominator among people demographics, anything that you can, sort of get a handle on?
Well, it depends on the drug of choice. As it relates to the opioids that we're seeing now in our community, it's mostly something that is in, it's white, it can be middle class, upper class, but it's really crossing all of the socioeconomic stratas, and we do see the second group is Hispanics. As it relates to opioids, when we talk about drugs like crack cocaine, that's mostly going to be Black and Latin. So it really depends on what we're talking about. Now, these are generalities that I'm talking about because it can cross any of the demographics, whether you come from urban a low-income community to a high-end community. We see drug trafficking in all of the communities.
Now, your deputies, they carry Narcan, is that correct?
Yes, Orange County deputy sheriffs who are first responders, those who are in uniform responding to 911 calls for service, are all carrying Narcan and naloxone today.
And those are not the antidotes, but help with an overdose for heroin in particular. Is that correct?
It is primarily for opioids. It is an antidote. However, it has an effective component for many other overdose situations, and we made that public policy decision about a year or so ago, and now several times a week deputy sheriffs are saving people's lives because they're there about 40% of the time before our EMS personnel arrive on the scene. And so because of that gap, sometimes they're the first ones there to be able to administer the Narcan.
I was reading some articles saying that not all police departments think that it's their responsibility to carry the Narcan and that it's a medical emergency, so it should be administered by the EMTs. That philosophy, you obviously don't agree with that. Is it the first response that you're more concerned with the victim being helped as much as they can?
We had to do our research. As you may recall, nearly 2 years ago, I brought this to the attention of our community and worked with Mayor Jacobs to create a heroin overdose task force. What that task force focused on was not just the demand side of the equation, but also law enforcement tends to focus on the supply side. You know, we do the enforcement piece. But through treatment, individuals are able to deal with their different addictions. And so we made a decision as a result of that task force looking at the best practices around the country that when we looked at the facts, again, 40% of the time, we have 4 minutes or less on average to reach an individual who is in respiratory failure because they've gone into overdose. And 40% of the time, Orange County deputy sheriffs were arriving on the scene before EMS. And so we're in the life-saving business, so we decided that could we do this? How much training was required? Our deputies watch a short video, and the price came down to a point where it was affordable for us to be able to do it. And so we have deployed it now and saved numerous lives since that period of time.
You mentioned the heroin task force that you and Mayor Jacobs started in 2015. Can you talk a little bit about that? And as you said, some of the actions that have come as a result to start dealing with the problem.
The challenge for us as a community was larger than just a law enforcement issue. Through the task force, in order to get the dollars and the type of awareness we needed in the community, we had to look beyond the law enforcement agencies and say to our healthcare industry, what can we do to assist you with bringing awareness to this? How can we as a community better utilize services to provide treatment for individuals? And when we attack it from both directions or perspectives as supply and demand, then we'll be highly, much more effective, I should say, as a community in dealing with this crisis.
I would think this is an incredible drain on resources for your department, both time and with money. Is there any funding, federal, state, available to help?
We are part of a task force, a high-intensity drug trafficking area grant has been received by this area where we're using some federal dollars, and we're also partnering with the Drug Enforcement Administration on combating this issue through enforcement, attacking this supply side before it ever even gets into the United States. And we can only do that by working through the federal government. Once it comes into our community, we have a number of other task forces that we work from throughout Orange County. In fact, just earlier today, we made a major announcement about several individuals involved in a drug trafficking organization in East Orange County, Seminole County, Volusia County, and Brevard counties, and they were prosecuted under the federal system and were convicted. And we fancied that organization's name as the Oviedo Soldiers because many of them lived in the Oviedo area and kind of preyed on this east side of Orange County.
Yeah. Sheriff, how can the community help you help this problem in general? What can we do?
The best thing that the community can do to help us combat the problem is to provide information. If they see individuals or know of individuals who are trafficking in narcotics on the streets of our community, they can contact us anonymously through Crime Line or directly through their respective law enforcement agencies. That is a big help to us. We do follow up on every one of those tips that comes in through Crime Line and other means. And again, the best thing you can do for your family members is make sure that they are aware of the dangers of getting involved in illegal substances.
Well, as you said too, it's anonymous. I think a lot of the hesitation may be because it's an illegal substance. Maybe some people aren't as willing to come forward. Sheriff, thank you so much, and thank you for your leadership. It's been a hard year.
Thank you. We're just trying to make certain that our community remains a very vibrant community with a high quality of life.
Thanks.